Welcome to the Healthcare Full Course by Damal Consult Career Academy. Whether you're starting a career in healthcare or looking to expand your knowledge, this course will cover everything you need to know, from healthcare systems and patient care to medical terminology and ethical practices. Stick around as we dive deep into the essential concepts of healthcare, helping you build a strong foundation for success. Introduction to Healthcare. What is healthcare? Healthcare refers to the organized delivery of medical services and interventions aimed at maintaining, improving, or restoring an individual's physical and mental health. It encompasses a wide range of activities and services that focus on disease prevention, treatment of illness and injury, and overall well-being. At its core, healthcare is about caring for people, ensuring they have the necessary access to resources that promote health, including medical treatment, preventive services, rehabilitation, and emotional support. Healthcare services can be provided by a variety of professionals and institutions, from doctors and nurses in hospitals to therapists, pharmacists, and caregivers in community settings. Healthcare delivery includes preventive care, immunizations, health screenings, and education to prevent diseases before they occur. Primary care, the first point of contact in the healthcare system, usually involving general practitioners or family doctors. Secondary care, specialized care provided by professionals such as cardiologists, dermatologists, and orthopedic surgeons. Tertiary care, advanced medical care provided for complex and severe cases, often in specialized hospitals. Healthcare can be delivered through public systems, private systems, or a combination of both, depending on the country or region. Importance of healthcare in society. Healthcare plays a fundamental role in maintaining the overall health and well-being of individuals and society. It is crucial not just for treating illness, but for preventing it and promoting a healthy population. Effective healthcare systems lead to longer life expectancies, improved quality of life, and more productive societies. Key reasons why healthcare is important: disease prevention. Through vaccinations, health screenings, and education, healthcare systems can prevent diseases from occurring or catching them early, reducing the overall burden of illness. Management of chronic conditions. Healthcare services help people manage long-term health issues like diabetes, hypertension, and heart disease, which are increasingly common in aging populations. Health equity. Access to healthcare ensures that people from all backgrounds can receive treatment when needed, reducing inequalities in health outcomes related to socioeconomic status or geographic location. Economic impact. Healthy individuals are more likely to contribute to the economy by being productive members of the workforce. Conversely, widespread illness and lack of access to healthcare can lead to financial instability, both at a personal and societal level. Public health and safety. Healthcare also plays a significant role in protecting the public from health threats such as epidemics or pandemics. By implementing public health measures, healthcare systems can prevent the spread of infectious diseases and ensure the safety of populations. Healthcare's importance extends beyond treating individuals. It supports the broader social, economic, and political fabric of communities. Healthcare systems around the world. Healthcare systems vary significantly around the world, shaped by different cultural, political, and economic factors. Generally, healthcare systems are divided into public government-funded, private privately funded, or a hybrid of the two. The structure of a healthcare system determines how care is delivered, who has access, and how much it costs. Types of healthcare systems. 1. Public healthcare systems. It is funded primarily by the government through taxation or social security contributions. Care is provided either free at the point of use or at a very low cost to the individual. Examples are National Health Service (NHS) in the United Kingdom, Medicare in Canada, and the healthcare systems in Scandinavian countries. The advantages are universal coverage, accessibility for all citizens, regardless of income. Disadvantages are long wait times for specialized treatments, higher taxation. 2. Private healthcare systems. It is funded through private health insurance or direct out-of-pocket payments by individuals. Healthcare providers are typically privately owned and operated. For example, the United States healthcare is largely privately managed, though public programs like Medicare and Medicaid exist. The advantage is that it gives faster access to treatment and more personalized care. The disadvantages are high costs, lack of coverage for lower-income individuals without insurance. 3. Hybrid systems. It is a combination of public and private healthcare services. Citizens have access to a publicly funded system, but also have the option to purchase private insurance for quicker or more specialized care. Examples are Australia and Germany. In these systems, the government provides a base level of healthcare for all citizens, but individuals can opt for private services. The advantage is that it combines the accessibility of public systems with the efficiency of private care. The disadvantage is that it brings about potential inequalities in care, depending on the individual's financial ability to access private services. Now let's talk about global comparison. In countries like the UK, universal healthcare ensures everyone receives care, regardless of their financial situation. In contrast, in the US, healthcare is largely market-driven, where individuals pay for insurance plans or use government programs like Medicaid. Canada's system is publicly funded, offering healthcare to all its citizens, with minimal costs at the point of service. While the structure of healthcare systems differs, the goal remains the same: to provide timely, effective, and efficient care to improve the population's health. The role of healthcare professionals. Healthcare professionals are the backbone of any healthcare system. They are responsible for diagnosing, treating, and caring for individuals across all life stages. The roles in healthcare are diverse, ranging from doctors and nurses to specialized therapists, pharmacists, and support staff. Key roles in healthcare: doctors, physicians. Doctors diagnose and treat illnesses and injuries. They can be general practitioners, GPs, who provide primary care, or specialists in fields like cardiology, neurology, or pediatrics. Doctors play a central role in managing patient care, prescribing medications, and performing surgeries. Nurses provide direct care to patients, often spending more time with them than doctors. They monitor vital signs, administer medication, assist with daily activities, and provide emotional support. Nurses also educate patients about their health conditions and treatments. Allied health professionals. These include physiotherapists, occupational therapists, radiographers, and dietitians who support patients' recovery and rehabilitation. For example, physiotherapists help patients regain movement after injury or surgery, while dietitians advise on nutrition and diet. Pharmacists play a critical role in healthcare by ensuring that patients receive the correct medications. They provide advice on how to take medicines safely and can answer questions about side effects or drug interactions. Healthcare assistants support nurses and doctors in providing basic care to patients. Their responsibilities may include helping with bathing, feeding, and moving patients, as well as checking vital signs. Healthcare administrators. These professionals manage healthcare facilities, ensuring that they run smoothly and efficiently. Healthcare administrators handle logistics, staffing, budgeting, and compliance with health regulations. Healthcare professionals work together in multidisciplinary teams to provide holistic care. Their roles are not just technical, but also include emotional and psychological support, ensuring the patient's overall well-being. Overview of career opportunities in healthcare. Healthcare offers a wide range of career opportunities that cater to different interests and skill sets. Whether you're interested in direct patient care, research, or healthcare management, there's a career path for you in the healthcare field. Careers in healthcare are not only rewarding, but also in high demand worldwide due to aging populations, advancements in medical technologies, and ongoing public health challenges. Popular career paths in healthcare. 1. Nursing. Nurses are in high demand globally. Nursing careers can vary from bedside care in hospitals to advanced roles, like nurse practitioners or nurse anesthetists, who can diagnose and treat patients independently. 2. Physician doctor. Becoming a physician is one of the most respected and rewarding careers in healthcare. Doctors can specialize in areas such as general practice, surgery, pediatrics, or psychiatry. The journey to becoming a doctor is long, but offers tremendous impact and responsibility. 3. Pharmacist. Pharmacists are critical to healthcare, as they ensure the safe dispensing of medications. They also offer consultation services and support patients in understanding how to manage their prescriptions. 4. Therapist. Careers such as physical therapy, occupational therapy, and speech therapy focus on rehabilitating patients and improving their quality of life. Therapists work in hospitals, rehabilitation centers, and private practice. 5. Medical technologist. Medical technologists and lab technicians play a crucial role in diagnosing diseases by analyzing blood, tissue, and other samples. This career is ideal for individuals who enjoy working behind the scenes in a lab setting. 6. Healthcare administration. If you have strong organizational and leadership skills, healthcare administration might be for you. Administrators manage the daily operations of healthcare facilities, ensuring they meet regulatory standards and run efficiently. 7. Public health. Public health professionals focus on improving the health of populations. Careers in this field include epidemiologists, public health analysts, and community health workers who work on disease prevention and health promotion at a large scale. 8. Mental health profession. Mental health careers, including psychologists, counselors, and social workers, are vital for addressing the growing demand for mental health services. They provide support, therapy, and care for individuals dealing with emotional and psychological challenges. Emerging career opportunities. Telemedicine. With the rise of digital healthcare, careers in telemedicine are expanding. Healthcare providers can offer remote consultations and care, particularly in rural or underserved areas. Health informatics. As healthcare becomes more data-driven, careers in health informatics, such as managing electronic health records and using data analytics for improved patient outcomes, are in demand. Genetics and genomics. With advancements in personalized medicine, roles in genetics and genomics are growing. Healthcare careers offer stability, growth, and the opportunity to make a meaningful impact on individuals' lives and the community. Whether on the front lines or behind the scenes, healthcare professionals play an essential role in maintaining the health of society. Conclusion on Chapter 1. Chapter 1 provides a comprehensive introduction to healthcare, covering its definition, importance, global systems, the vital role of professionals, and the vast array of career opportunities available. As you explore further chapters, you will gain deeper insights into the workings of healthcare systems, ethical considerations, and the latest innovations shaping the future of healthcare. Types of healthcare systems. Healthcare systems around the world are designed to meet the needs of the population, but they vary significantly in terms of structure, funding, and service delivery. In this chapter, we will explore different types of healthcare systems, focusing on the distinctions between public and private healthcare, the levels of care, and various healthcare models. We will also dive into the financial aspects of healthcare, the economic implications of healthcare costs, and how different countries manage healthcare services. Public versus private healthcare. healthcare systems are often categorized into public and private sectors, each with distinct roles in service delivery, funding, and accessibility. Public healthcare. In public healthcare systems, the government is primarily responsible for financing and providing healthcare services. These systems are funded through taxes or social insurance schemes, making healthcare services either free or highly subsidized for the general population. Public healthcare systems aim to provide equitable access to care, regardless of income level. Examples include the National Health Service (NHS) in the UK and Medicare in Australia. Private healthcare. Private healthcare is predominantly funded through private means, such as out-of-pocket payments or private insurance. Private healthcare often offers quicker access to services and a wider choice of providers. However, it can be expensive and may limit access for individuals without adequate insurance coverage. Countries like the United States rely heavily on private healthcare systems, though public programs like Medicare and Medicaid exist for certain groups. Public and private healthcare systems often coexist within the same country, with varying degrees of integration. While public systems aim for universality, private healthcare may offer more personalized and specialized services. Primary, secondary, and tertiary care. Healthcare systems are organized into different levels of care based on the complexity and specialization of the services provided. These levels include primary, secondary, and tertiary care. Primary care. This is the first point of contact for individuals seeking medical attention. It involves general healthcare services provided by general practitioners, GPs, nurses, or family doctors. Primary care addresses a broad range of health issues, including preventive care, health education, and treatment of common illnesses. It is essential for early detection and management of health conditions. Secondary care. Secondary care involves more specialized services and is typically provided by specialists after a referral from a primary care provider. It includes treatments for more complex conditions that require specialized knowledge or equipment, such as surgery, diagnostic services, or specialist consultations. Tertiary care. Tertiary care refers to highly specialized and advanced medical treatment. This level of care is provided by specialized healthcare providers in hospitals or specialized centers. It often includes complex surgeries, cancer treatments, or advanced medical interventions that require state-of-the-art facilities and expert professionals. Each level of care serves a specific purpose, and healthcare systems aim to ensure smooth transitions between these levels to provide comprehensive and continuous care for patients. Universal healthcare systems. Universal healthcare refers to healthcare systems designed to provide access to healthcare services for all individuals without causing financial hardship. Universal healthcare ensures that people receive the medical care they need, regardless of their socioeconomic status, through publicly funded or regulated systems. Key features of universal healthcare systems include equity. Everyone has equal access to healthcare services, reducing health disparities between different groups. Comprehensive coverage. Universal healthcare systems cover a wide range of services, including primary, secondary, and tertiary care, as well as preventive and rehabilitative services. Financial protection. Individuals are protected from the financial risks associated with paying for healthcare out of pocket. Countries like the United Kingdom NHS, Canada, and France operate universal healthcare systems that are funded through taxation or social insurance. While these systems provide free or highly subsidized healthcare services, they often face challenges such as long waiting times or limited access to certain treatments. Managed care and insurance. Managed care is a system designed to control the cost, quality, and access to healthcare services. In managed care systems, health insurance companies contract with healthcare providers to create networks that offer services at lower costs to insured individuals. The aim is to streamline care, reduce unnecessary procedures, and improve overall efficiency in healthcare delivery. There are different models of managed care, Hulpmaintenization, HMOs. Diese Organisationspredischen Networko Doktorist, Patiënten Dedicratie, PCP Andresievere Festverfake HMO Semfaciprovite. Preferred provisions pause, passo for more forexenti. Allowing patient patiency, thotheriri affination. Point of service pause plans. These plans combine elements of both HMOs and pause, where patients choose a primary care provider and need referrals for specialists, but can also seek care outside the network at a higher cost. Managed care is most common in countries with private health insurance systems, such as the United States, where insurance companies play a significant role in determining access to healthcare services. While managed care has been effective in controlling costs, critics argue that it can limit patient choice and access to certain services. Health economics cost of healthcare. Healthcare systems must balance quality, access, and cost. Health economics focuses on understanding how resources are allocated within healthcare and how those decisions impact the overall cost of care. Several factors drive the cost of healthcare, including aging population. As populations age, there is an increased demand for healthcare services, particularly for chronic conditions and long-term care, which raises overall costs. Technology and innovation. Advances in medical technology and treatments, while improving care outcomes, are often expensive to develop and implement, contributing to rising healthcare costs. Administrative costs. In some countries, particularly those with complex insurance systems like the United States, administrative costs related to insurance and billing processes make up a significant portion of healthcare expenses. Pharmaceutical costs. The cost of medications, particularly in countries without price regulations, can substantially increase healthcare costs. The United States, for example, has some of the highest pharmaceutical prices globally. Health economics also explores how different payment models, such as fee-for-service or capitation, influence healthcare spending and the incentives for providers. Governments often need to balance the rising costs of healthcare with maintaining access and quality for the population. Comparison of healthcare systems. UK, USA, Canada. Healthcare systems vary widely between countries, reflecting different approaches to funding, service delivery, and healthcare philosophy. Let's compare the healthcare systems of the United Kingdom NHS, the United States, and Canada. United Kingdom NHS. The National Health Service (NHS) is a publicly funded healthcare system providing free healthcare to all residents through taxation. The NHS covers a wide range of services, from primary care to specialized treatments. While the NHS is highly praised for its universal access, it faces challenges such as long waiting times for elective procedures and high demand for services. United States. The healthcare system in the United States is primarily private, with a mix of public programs such as Medicare and Medicaid for specific populations, for example, the elderly, low-income individuals. Most individuals obtain health insurance through their employers or purchase it privately. The U.S. has some of the highest healthcare costs globally, with high administrative expenses, expensive treatments, and significant disparities in access to care. Canada. Canada operates a single-payer healthcare system, where each province or territory provides healthcare services through public funding. Basic healthcare is covered for all citizens, but individuals may need to purchase private insurance for additional services like dental or vision care. The Canadian system is known for its equity and access, but like the NHS, it faces issues with wait times for specialist care. By comparing these systems, we can see how different healthcare models address the core challenges of access, cost, and quality. While public systems like those in the UK and Canada prioritize universal access, the U.S. system, with its private insurance model, often leads to higher costs and disparities in healthcare access. In conclusion, understanding the various types of healthcare systems, their funding models, and the levels of care they provide is essential for appreciating the complexity of healthcare delivery globally. Each system faces its unique challenges, whether related to cost, access, or quality, but ultimately aims to provide better health outcomes for the population. Healthcare systems in the UK, USA, and Canada. This chapter provides a comparative overview of the healthcare systems in the UK, USA, and Canada. Each country has a distinct approach to healthcare delivery, influenced by its cultural, political, and economic context. The chapter will cover how these systems are structured, financed, and the challenges they face, as well as insights into healthcare employment opportunities. UK healthcare system. Overview of the NHS National Health Service. The UK's National Health Service (NHS) is one of the most well-known public healthcare systems in the world. Established in 1948, the NHS provides free or low-cost healthcare to all UK residents, funded primarily through taxation. The NHS is founded on the principle that healthcare should be accessible to all, regardless of income, with a strong emphasis on primary care. NHS structure: primary, secondary, and tertiary care. The NHS is divided into 3 levels. Primary care includes general practitioners, GPs, pharmacies, and dental care, acting as the first point of contact for patients. Secondary care involves specialist treatment provided by hospitals, typically upon referral from a GP. Tertiary care, highly specialized treatment such as oncology or neurosurgery, provided in specialized hospitals or departments. Public versus private healthcare in THUC primarily relies on public healthcare through the NHS. But there is a small private sector where individuals can choose private treatment for shorter wait times or more personalized services. Private healthcare is often funded through insurance or out-of-pocket payments, offering an alternative for those who can afford it. How the NHS is funded. THENS is funded through general taxation and national insurance contributions. There is no direct charge for most healthcare services, though some services, such as dental care and prescriptions, may incur small fees. Healthcare jobs in the UK. How to apply. Visa requirements. THUC offers a variety of healthcare jobs, from doctors and nurses to administrative and support staff. Foreign healthcare workers need to meet specific visa requirements, including the Health and Care Worker Visa, and obtain registration with professional bodies like the General Medical Council (GMC) for doctors and the Nursing and Midwifery Council (NMC) for nurses. Skilled workers are in high demand due to staffing shortages in the NHS. Challenges facing the NHS: funding, staffing, wait times. THENS faces significant challenges, including funding shortages. As healthcare costs rise, the NHS struggles to meet demand with its current funding levels. Staffing: a shortage of healthcare professionals has led to increased workloads and burnout. Wait times: long waiting periods for non-emergency treatments remain a critical issue, particularly in secondary and tertiary care. USA healthcare system. Review of the US healthcare system. The US healthcare system is unique in that it lacks a universal healthcare program. Instead, it is a mixed system with both public and private components. Healthcare is largely provided by private entities, and individuals are responsible for obtaining their own insurance, though public programs exist for vulnerable populations. Private insurance versus public programs. Medicare or Medicaid. Whose healthcare system operates primarily on a private insurance model, where individuals either receive insurance through their employer or purchase it independently. Public programs include Medicare, a federal program providing healthcare coverage for individuals aged 65 and older or those with certain disabilities. Medicaid, a joint federal and state program that offers healthcare to low-income individuals and families. The role of the Affordable Care Act (ACA). The Affordable Care Act (ACA), passed in 2010, aimed to increase healthcare coverage by expanding Medicaid and creating healthcare exchanges where individuals can buy insurance. The ACA introduced measures to reduce the number of uninsured Americans, but its impact has been controversial, particularly with ongoing political debates around its future. Healthcare costs in the USA. Healthcare costs in the US are among the highest in the world, driven by expensive medical procedures, high administrative costs, and the profit-driven insurance industry. Out-of-pocket expenses can be significant, even with insurance, particularly for deductibles, premiums, and co-pays. Healthcare jobs in the USA. Visa sponsorship, licensing. Healthcare professionals from outside the US must navigate visa requirements, such as the H-1B visa for skilled workers or the J-1 visa for exchange programs. Foreign medical graduates need to pass licensing exams like the USM United States Medical Licensing Examination for doctors, and nurses must pass the NCLEX National Council Licensure Examination. The healthcare industry in the US offers high salaries, but competition can be intense. Current challenges in the US healthcare system: cost. Access. The US healthcare system faces several challenges. High costs. Healthcare remains prohibitively expensive for many, leading to significant disparities in access. Limited access. Despite public programs like Medicare and Medicaid, millions remain uninsured or underinsured, especially in rural areas. Canada Healthcare System. A review of the Canadian healthcare system. Canada's healthcare system, known as Medicare, is publicly funded and provides universal coverage to all Canadian citizens and permanent residents. Healthcare services are delivered through provincial and territorial governments, with most services being free at the point of use. Medicare Canada's publicly funded system. Canada's healthcare system is funded through general taxation, with the government covering most essential services. Prescription drugs and dental care are not covered under Medicare, and individuals may need private insurance for these services. Provincial and territorial health services. Each of Canada's provinces and territories manages its own healthcare services, which means there may be variations in the delivery of care. For instance, some provinces cover more services or have different wait times based on local demand. Public versus private healthcare in Canada. While Canada's system is primarily public, there is a small private healthcare sector that provides additional services, such as elective surgeries, or allows individuals to avoid wait times for certain treatments. Private healthcare is more commonly used for services not covered by Medicare, such as dental and vision care. Healthcare jobs in Canada. Visa licensing. Per pathways. Healthcare professionals wishing to work in Canada must meet licensing requirements specific to their profession, such as passing the Medical Council of Canada qualifying examination (MCA) for doctors or obtaining certification from the Canadian Nurses Association (CNA). International healthcare workers may apply for a work visa through programs such as the Express Entry System, which can also lead to permanent residency. Healthcare challenges in Canada. Wait times. Accessibility. Canada's healthcare system faces several key challenges. Wait times. Long wait times for certain non-urgent procedures and specialist care are a major issue, particularly in densely populated areas. Accessibility. While healthcare is universally provided, rural and remote regions often face difficulties in accessing the same level of care as urban centers. In this chapter, we have explored the healthcare systems of the UK, USA, and Canada, highlighting the structure, funding, job opportunities, and challenges faced by each system. These countries, despite their differences in healthcare delivery, share common challenges such as funding issues, staff shortages, and the balance between public and private care. Understanding these systems provides insight into how different nations Approach healthcare and the opportunities and challenges they present for healthcare professionals. Basic medical terminology. Medical terminology is a critical aspect of healthcare, allowing professionals to communicate efficiently and accurately. Understanding medical terms, abbreviations, and symbols is essential for anyone entering the healthcare field, as it improves communication between doctors, nurses, pharmacists, and other health workers. In this chapter, we will cover the fundamentals of medical terminology, including anatomy, physiology, pharmacology terms, and diagnostic language. Understanding common medical terms. Medical terminology is largely based on Greek and Latin roots, prefixes, and suffixes. Knowing the basic components of medical terms helps in understanding complex words used in diagnoses, treatments, and medical reports. Most medical terms have three components. Prefix appears at the beginning of the word and typically indicates location, time, number, or status. For example, hyper means over or excessive. Root, the central part of the word, usually indicating a body part or system. For example, cardi refers to the heart. Suffix appears at the end of the word and often indicates a condition, disease, or procedure. For example, itis means inflammation, as in arthritis. Examples of common medical terms: hypertension, hyper, excessive, plus, tension, pressure equals high blood pressure. Osteoarthritis, osteo, bone, plus, arthur, joint, plus, itis, inflammation equals inflammation of the joints and bones. Gastroenterology, gastro, stomach, plus, entero, intestine, plus, logi, study of equals the study of the stomach and intestines. Understanding these building blocks will enable you to decode unfamiliar medical terms by breaking them down into their individual parts. Anatomy and physiology basics. Anatomy is the study of the structure of the body, while physiology is the study of its functions. Knowledge of these basics is essential for understanding how the body works, as well as how diseases and treatments affect the body. Key body systems. Cardiovascular system includes the heart and blood vessels. It is responsible for pumping blood throughout the body to supply organs with oxygen and nutrients. Respiratory system involves the lungs and airways. Its primary function is to supply oxygen to the blood and remove carbon dioxide. Nervous system consists of the brain, spinal cord, and nerves. It controls voluntary and involuntary functions, including movement, sensation, and reflexes. Musculoskeletal system comprises bones, muscles, and joints. It provides structural support and enables movement. Digestive system includes the stomach, intestines, liver, and pancreas. It breaks down food and absorbs nutrients for the body to use. Basic anatomical terms. Anterior refers to the front of the body. Posterior refers to the back of the body. Superior means above, toward the head. Inferior means below, toward the feet. Proximal, closer to the point of attachment to the body. Distal, further from the point of attachment to the body. These terms help describe locations and positions of structures in the body, which is crucial for accurate communication in healthcare settings. Pharmacology terms. Pharmacology is the study of drugs and their effects on the body. Understanding pharmacology terms is vital for those involved in medication management and patient care. Key pharmacological drug classification. Medications are grouped into categories based on their effects. For example, analgesics are pain relievers, and antibiotics are used to treat bacterial infections. Dosage, the specific amount of medication to be taken, often expressed in milligrams mg or milliliters ml. Dosage must be tailored to the patient's needs. Route of administration, how a drug is given, such as oral by mouth, intravenous IV, or topical applied to the skin. Side effects, unintended effects that may occur when taking a medication, such as nausea, dizziness, or allergic reactions. Pharmacokinetics refers to how the body absorbs, distributes, metabolizes, and excretes a drug. Pharmacodynamics, the study of the effects of drugs on the body and how they achieve their therapeutic effect. Common pharmacology terms: antipyretic, diuretic, vasodilator. Medical abbreviations and symbols. Healthcare professionals use abbreviations and symbols to communicate efficiently in medical records, prescriptions, and treatment notes. However, it's crucial to use these abbreviations accurately to avoid miscommunication. Common abbreviations: BP, blood pressure; HR, heart rate; 4. Intravenous, referring to a method of administering medication directly into a vein. Paren, as needed, used for medication that is not taken on a regular schedule. NPO, nothing by mouth, used when a patient is not allowed to eat or drink. Symbols commonly used in medicine: degrees Celsius or Fahrenheit temperature. Increase, for example, BP means increased blood pressure. Decrease, for example, HR means decreased heart rate. ARCS, prescription or treatment plan. Familiarity with these abbreviations and symbols is essential for reading medical charts, patient records, and treatment plans efficiently. Diagnostic and procedural terminology. Diagnostic terms refer to the identification of diseases, disorders, or injuries, while procedural terms are related to treatments and tests performed on the patient. Common diagnostic terms: biopsy, the removal of tissue for examination to determine the presence of a disease, such as cancer. CT scan, a diagnostic imaging procedure that uses X-rays to create detailed pictures of the body structures. MRI, magnetic resonance imaging, a type of scan that uses magnets and radio waves to produce detailed images of organs and tissues. Common procedural terms: appendectomy, surgical removal of the appendix; angioplasty, a procedure to open narrowed or blocked blood vessels supplying the heart; colonoscopy, an examination of the colon using a flexible tube with a camera. Diagnostic and procedural terms help healthcare professionals communicate about the medical actions required to diagnose, treat, or monitor a patient's condition. These terms are essential in daily clinical work, from surgical procedures to imaging techniques. In conclusion, understanding basic medical terminology is crucial for anyone entering the healthcare field. Medical terms, abbreviations, anatomy, and pharmacology knowledge are the foundation for effective communication in the medical environment. With this chapter, you now have a basic understanding of how medical terminology is structured and how it applies to anatomy, pharmacology, diagnostics, and treatment. Being familiar with these terms will not only help you interact with healthcare professionals, but also ensure accurate care and documentation, which is vital in medical practice. Chapter 5: Healthcare Ethics and Law. Healthcare ethics and law are fundamental in ensuring that patients receive fair, respectful, and legally protected care. This chapter will explore the ethical principles that guide healthcare professionals in their decision-making, as well as the legal frameworks that enforce these principles. Introduction to Healthcare Ethics. Healthcare ethics refers to the set of moral principles that guide the behavior and decision-making processes of healthcare professionals. These principles aim to protect patients' well-being and uphold their dignity. Key ethical principles in healthcare include autonomy, respecting a patient's right to make their own decisions about their care; beneficence, acting in the best interest of the patient; non-maleficence, the principle of do no harm to the patient; justice, treating patients fairly and ensuring equitable distribution of healthcare resources. These principles form the foundation of ethical behavior in healthcare settings and guide professionals in navigating complex situations, from patient care to resource allocation. Patient rights and confidentiality. patient rights ensure that individuals receiving medical care are treated with respect and dignity while protecting their personal information. Two major legislative frameworks that address patient confidentiality and data protection are HIPAA Health Insurance Portability and Accountability Act in the USA and GDPR General Data Protection Regulation in the UK and EU. HIPAA in THUSA. HIPAA, established in 1996, sets national standards for the protection of patient health information. The Act ensures that sensitive patient information is kept confidential and only shared with the patient's consent or as required by law. It also provides guidelines on how healthcare providers should secure medical records and respond to data breaches. Key points of HIPAA include protection of protected health information, FI, patients' rights to access their medical records, guidelines for electronic storage and sharing of health data. GDPR in the UK and GDPR, amended in 2018, governs data protection and privacy for individuals within the European Union and the UK. While GDPR covers all types of personal data, it is particularly relevant to healthcare providers due to the sensitive nature of health information. Key aspects of GDPR include the right to be informed about how personal data is used, the right to access and obtain copies of personal health information, the right to rectification and deletion of inaccurate or outdated data, strict regulations regarding the processing and sharing of personal data. Both HIPAA and GDPR emphasize the importance of protecting patient information and ensuring confidentiality in healthcare environments. Informed consent and patient autonomy. Informed consent is a fundamental ethical and legal requirement in healthcare that ensures patients understand their treatment options and voluntarily agree to the care they receive. It is based on the principle of patient autonomy, which asserts that patients have the right to make decisions about their healthcare without coercion. For informed consent to be valid, healthcare providers must clearly explain the patient's diagnosis, treatment options, risks, and benefits. Ensure the patient comprehends the information provided. Obtain the patient's voluntary agreement to proceed with treatment. This process is essential in procedures ranging from routine medical care to complex surgeries. It is a legal obligation in many countries, with failure to obtain proper informed consent, potentially leading to claims of medical malpractice. Healthcare legalities, malpractice and negligence. Medical malpractice and negligence are critical legal concerns in healthcare, as they directly impact patient safety and trust in the medical system. Malpractice occurs when a healthcare provider fails to deliver the standard of care expected in their profession, resulting in harm to the patient. Examples of malpractice include misdiagnosis, surgical errors, and improper treatment. To establish malpractice, the following elements must be proven: duty of care. The provider had an obligation to care for the patient. Breach of duty. The provider failed to meet the expected standard of care. Causation. The breach directly caused the patient's injury. Damages. The patient suffered harm as a result of the provider's negligence. Negligence. Negligency in healthcare refers to a failure to take appropriate action, leading to patient harm. While similar to malpractice, negligence does not always require intent. Common examples include failing to monitor a patient's condition, delayed diagnosis or treatment, improper use of medical equipment. In both malpractice and negligence cases, patients may seek legal recourse, resulting in compensation for damages, fines for the healthcare provider, or changes in clinical practices. Ethical decision-making in healthcare. Ethical decision-making is a complex process in healthcare, as professionals must balance patient needs, legal obligations, and resource limitations. Different countries have specific frameworks that guide healthcare practitioners through these decisions. Examples from the UK, USA, and Canada. United Kingdom, The UK's National Health Service (NHS) places a strong emphasis on patient-centered care, ensuring that decisions respect patient autonomy and are made with full consent. Ethical dilemmas often arise in the context of resource allocation, especially in publicly funded systems like the NHS. Ethical frameworks such as the NHS Constitution guide decision-making. United States. In the US, healthcare providers must navigate a more complex, often privatized system, where ethical considerations include both patient care and cost management. Healthcare ethics committees are often consulted to resolve conflicts regarding treatment decisions, end-of-life care, and access to experimental treatments. Canada. Canadian healthcare focuses on universal access to care, with ethical decision-making often centered on balancing patient autonomy with equitable healthcare distribution. Ethical dilemmas frequently involve end-of-life decisions, as Canada allows medical assistance in dying made under specific circumstances, creating the need for clear ethical guidelines. Across these countries, ethical decision-making often involves balancing competing values such as patient autonomy, beneficence, and justice while staying within legal and institutional guidelines. Conclusion: healthcare ethics and law are intertwined in ensuring that patients receive care that is not only medically sound, but also morally and legally justified. This chapter has explored key concepts such as patient rights, confidentiality, informed consent, and legalities like malpractice and negligence. Additionally, the challenges of ethical decision-making were highlighted with examples from the UK, USA, and Canada. Understanding these principles is essential for healthcare professionals to provide compassionate, respectful, and lawful care to their patients. Chapter 6: Patient Care and Safety. Basics of patient care. Patient care is at the core of healthcare practice, focusing on addressing the physical, emotional, and psychological needs of patients. The fundamentals of patient care involve tasks such as ensuring proper hygiene, monitoring vital signs, administering medication, and maintaining a safe environment. Key aspects include communication. Clear and compassionate communication with patients helps in understanding their needs and concerns. Dignity and respect. Patients should always be treated with respect, and their privacy and autonomy should be maintained. Comfort and assistance. Providing patients with physical comfort, such as adjusting their position in bed, managing pain, or assisting with mobility, ensures their overall well-being. Patient education. Educating patients about their conditions and treatments empowers them to take an active role in their recovery. Healthcare workers should also maintain a holistic approach, taking into account not only physical health, but also mental and emotional support. Importance of patient safety. Patient safety is a critical component of quality healthcare. Ensuring that patients are not harmed during care is paramount to maintaining trust and promoting recovery. Key areas of patient safety include error prevention. Reducing medical errors, such as medication mistakes or improper procedures, is essential. This requires accurate record keeping, proper communication, and thorough checks before administering treatments. Fall prevention. Falls are common in healthcare settings, especially among elderly patients. Using bed rails, non-slip footwear, and assisting patients during transfers can significantly reduce fall risks. Safe use of equipment. Ensuring that all medical equipment is functioning properly and used correctly is vital to patient safety. Patient identification. Proper identification of patients before administering medication or procedures is a crucial step in avoiding errors. Healthcare professionals must be trained to recognize potential hazards and take proactive steps to avoid harm. Infection control and prevention. Infection control is critical in preventing the spread of infections within healthcare settings. Healthcare-associated infections highs can result in prolonged hospital stays and even life-threatening complications. Key infection control practices include hand hygiene. Frequent and proper hand washing is one of the most effective ways to prevent infections. Alcohol-based hand sanitizers should also be used when appropriate. Personal protective equipment (PPE), using gloves, gowns, masks, and face shields appropriately when interacting with patients minimizes the risk of spreading infections. Sterilization of equipment. Medical instruments must be properly sterilized after each use to prevent the transmission of infectious agents. Isolation procedures. Patients with contagious infections should be placed in isolation to protect other patients and healthcare workers. Waste disposal. Proper disposal of medical waste, including needles, dressings, and other contaminated materials, is essential in infection prevention. All healthcare staff must adhere strictly to infection control protocols to protect both patients and themselves. First aid and basic life support (BLS), CPR. First aid and basic life support (BLS) are crucial skills for healthcare professionals, enabling them to provide immediate care in emergency situations. BLS typically includes cardiopulmonary resuscitation (CPR) and other techniques designed to maintain circulation and breathing until advanced care is available. CPR. In cases of cardiac arrest, CPR helps maintain blood flow to vital organs by manually compressing the chest. The standard procedure involves 30 chest compressions followed by 2 rescue breaths, compressing the chest at a rate of 100 to 120 compressions per minute. Automated external defibrillator aid (EADS) can be used to restore normal heart rhythm in cases of sudden cardiac arrest. Knowing how to operate an aid can save lives. Choking. The Heimlich maneuver can dislodge objects from the airway of a choking patient. Bleeding and wounds. Applying pressure, cleaning wounds, and properly dressing them can prevent infection and promote healing. Fractures and sprains. Immobilizing fractures and applying ice to sprains are important steps in reducing pain and preventing further injury. Healthcare providers should undergo regular BLS training and maintain certification in these life-saving techniques. Dealing with medical emergencies. Medical emergencies can occur suddenly, requiring healthcare workers to act quickly and effectively. Preparedness is key in managing these situations. Common medical emergencies include cardiac arrest, immediate CPR, and defibrillation. Using an aid can be life-saving. Stroke. Recognizing the signs of a stroke, for example, facial drooping, arm weakness, speech difficulty, and ensuring rapid medical intervention is critical. Severe bleeding. Stemming bleeding through direct pressure or using tourniquets can prevent shock and death. Seizures. Ensuring the patient is in a safe position, preventing injury, and providing post-seizure care are essential. Anaphylaxis. Administering epinephrine immediately can counteract severe allergic reactions. Each medical emergency requires a unique response, but the guiding principles are to remain calm, act swiftly, and follow established emergency protocols. Clear communication with the medical team and rapid access to emergency equipment are vital in these situations. Conclusion. Patient care and safety are the foundation of healthcare services. By focusing on proper patient care techniques, ensuring patient safety, following infection control protocols, being prepared with basic life support skills, and effectively managing medical emergencies, healthcare professionals can provide the highest level of care while minimizing risks. It is essential for all healthcare providers to continually update their knowledge and skills in these areas to ensure patient well-being and safety. Chapter 7. Healthcare Administration and Management. Healthcare administration and management is a critical field that ensures the effective operation of healthcare systems, facilities, and services. From overseeing hospital operations to managing resources and staff, healthcare managers play a pivotal role in ensuring that healthcare organizations run smoothly while meeting patient needs and adhering to industry regulations. Overview of healthcare administration. Healthcare administration refers to the leadership and management of healthcare systems, hospitals, and other medical facilities. Administrators are responsible for ensuring that healthcare providers deliver high-quality care while maintaining the operational efficiency of their facilities. This field combines knowledge from business administration, public health, and management to ensure that healthcare services are effective and sustainable. Key responsibilities of healthcare administrators: strategic planning and organizational development, compliance with healthcare regulations and laws, managing relationships with stakeholders, patients, healthcare providers, insurance companies, improving healthcare delivery through innovation and policy changes, managing healthcare facilities. Managing a healthcare facility involves overseeing the day-to-day operations of hospitals, clinics, nursing homes, or other medical centers. This role requires balancing patient care with business operations, ensuring facilities operate efficiently while maintaining high standards of care. Key aspects of managing healthcare facility include resource allocation, ensuring that equipment, medication, and staff are optimally distributed to meet patient needs. Patient flow, coordinating patient admissions, discharges, and transfers to ensure minimal wait times and efficient care delivery. Maintenance and safety, ensuring that the physical environment of the facility is safe, clean, and functional, including the upkeep of medical equipment. Staffing, ensure there are enough qualified healthcare providers to meet patient demand while also considering shifts, training, and staff morale. Effective facility management can lead to improved patient outcomes, better resource use, and higher patient satisfaction. Role of a healthcare manager. A healthcare manager plays a crucial role in bridging the gap between medical staff and administrative staff, ensuring that both operational and clinical goals are achieved. Healthcare managers typically handle budgeting, policy creation, compliance, and staff management, while keeping patient care at the forefront of their decisions. Key duties of a healthcare manager include leadership, guiding healthcare teams to meet strategic goals and improve patient care quality, budgeting and financial oversight, managing healthcare finances, allocating resources, and ensuring financial sustainability, regulatory compliance, ensuring that the facility complies with healthcare laws, regulations, and accreditation requirements. Staff management, overseeing recruitment, training, and retention of staff, while also managing performance evaluations and labor relations. Policy development, developing and implementing policies that enhance the efficiency of healthcare delivery and ensure ethical practices. A healthcare manager must possess strong leadership skills, the ability to adapt to a rapidly changing healthcare environment, and a deep understanding of both clinical operations and business administration. Human resources in healthcare. UK, USA, and Canada focus. Human resources HR in healthcare is vital for recruiting, retaining, and managing healthcare professionals. The healthcare workforce is the backbone of any medical system, and HR departments must ensure that healthcare institutions are staffed with skilled, motivated professionals to deliver patient care. UK. In the UK, the National Health Service (NHS) is the largest employer, with a strong emphasis on training, development, and workforce planning. HR in the NHS focuses on staff well-being, career progression, and meeting the needs of a diverse, multicultural workforce. USA. RIN The USA focuses on meeting regulatory standards, dealing with diverse employment laws at the state and federal levels, and managing benefits like health insurance and retirement plans. With the competitive healthcare labor market, HR departments often focus on recruitment, retention, and managing workforce shortages. Canada. In Canada, healthcare is publicly funded, and HR departments focus on managing labor unions, ensuring staff compliance with provincial regulations, and maintaining employee satisfaction in a system that faces shortages in rural areas. Training, diversity, and equity are key priorities for HR teams in Canadian healthcare settings. Across all three countries, HR in healthcare involves recruitment and retention, sourcing qualified professionals and retaining them through competitive benefits and career development opportunities. Staff training and development, providing ongoing education and training to ensure healthcare professionals are up to date with the latest healthcare practices and technologies. Workforce planning, predicting future staffing needs and addressing potential shortages or surpluses. Employee well-being, ensuring that staff have a healthy work-life balance and addressing any issues related to burnout or workplace stress. Financial management in healthcare. Financial management in healthcare involves managing the finances of healthcare organizations to ensure that they are both financially viable and able to provide high-quality care. This includes budgeting, accounting, financial reporting, and the management of revenue cycles. Key components of financial management in healthcare include budgeting, developing Gandispame units, and theenterial organization. These include differentiation, revenue cyclement, ensuring thathalifer date. These involve billing, coding, claims pricing, and collecting PSME. Cost control, augmenting cost-saving measure rest weight work, improve efficiency, and manageris fosifies. Investment and equipment, managing long-term investments, sukas equipment, technology, or facility panis. Compliance and datenting, ensuring thathagering, including Medicaid, and insurance acquired, as well as inteneguitin. Financial manasti, while ensuring thinchiate. Healthcare management. Healthcare management is a broader term that encompasses all aspects of managing healthcare organizations, from overseeing staff and operations to ensuring compliance and financial stability. It requires a deep understanding of the unique challenges faced by healthcare institutions, such as rising costs, regulatory changes, technological advancements, and patient expectations. Key aspects of healthcare management include strategic planning, setting long-term goals for the healthcare organization and developing strategies to meet those goals. Quality improvement, continuously improving the quality of care through evidence-based practices, patient feedback, and data analysis. Technology integration, implementing healthcare technologies like electronic health records (EHRs), telemedicine, and AI-driven diagnostics to improve patient care and operational efficiency. Patient-centered care, focusing on the needs of the patient, ensuring that healthcare services are delivered with compassion, respect, and understanding of individual needs. Healthcare management requires balancing the delivery of high-quality care with operational efficiency, financial sustainability, and regulatory compliance. Leaders in this field must be skilled in decision-making, communication, and managing diverse teams to succeed in today's complex healthcare environment. Conclusion. Chapter 7 highlights the complexity of healthcare administration and management, emphasizing the need for strong leadership, strategic thinking, and financial acumen. Whether managing human resources, facilities, or finances, healthcare administrators play a crucial role in ensuring that healthcare systems function smoothly and continue to provide high-quality patient care. The healthcare environment is constantly evolving, requiring administrators and managers to adapt and innovate to meet both the operational needs of their organizations and the growing expectations of patients and regulatory bodies. Effective healthcare administration ultimately contributes to the overall well-being of the community by ensuring that healthcare services are accessible, sustainable, and delivered with excellence. Chapter 8: Digital Healthcare and Technology. In this chapter, we explore the rapidly evolving intersection of healthcare and digital technologies. As healthcare systems across the globe strive to improve efficiency, access, and quality of care, digital healthcare and technological innovations are playing a critical role in transforming the sector. From electronic health records to telemedicine and artificial intelligence to wearables, this chapter provides a comprehensive overview of how technology is reshaping healthcare delivery and management. Introduction to Health Information Systems. HIS. Health information systems (HIS) are critical digital infrastructures that support the collection, storage, management, and transmission of healthcare-related data. HIS includes multiple components such as electronic health records (EHR), laboratory information systems, radiology systems, and billing systems, all designed to streamline healthcare processes. Health information systems (HIS) provides several benefits: efficiency, automating administrative tasks, reducing paperwork, and enhancing communication between healthcare providers. Data management, centralizing patient data to facilitate easy access, retrieval, and sharing among healthcare professionals. Decision support, offering clinical decision support tools that help physicians make evidence-based medical decisions. Patient safety, reducing medical errors through accurate and up-to-date patient records. For healthcare systems to function optimally, health information systems (HIS) must be reliable, secure, and interoperable, allowing data sharing across institutions while maintaining patient privacy. Electronic health records (EHR) in the UK, USA, and Canada. Electronic health records (EHR) are digital versions of patients' paper charts and contain comprehensive information about a patient's medical history, including diagnoses, treatments, medications, lab results, and immunization records. EHR systems have become a standard in modern healthcare across many countries, with varying levels of implementation and adoption. United Kingdom. The National Health Service (NHS) in the UK has made significant strides toward digitizing patient records. The NHS has centralized much of its data under the NHS Spine, which connects hospitals, clinics, and general practitioners. Despite efforts, challenges such as legacy systems and slow adoption remain. United States. EHR adoption has been widely promoted through the Health Information Technology for Economic and Clinical Health High-Tech Act, which incentivized healthcare providers to implement EHRs. However, interoperability remains a challenge, as various healthcare organizations use different EHR systems, creating barriers to seamless data sharing. Canada has also invested in EHR systems, with its Canada Health Infoway initiative aimed at promoting digital health across provinces. Though implementation is decentralized, with each province managing its own EHRs, the aim is to achieve better coordination between healthcare services. Overall, EHRs provide significant benefits, such as reducing medical errors and improving the continuity of care. But challenges like cost, training, and interoperability continue to hinder full realization of their potential. Telemedicine and remote care. Telemedicine refers to the delivery of healthcare services via digital communication technologies, such as video conferencing, mobile apps, and remote monitoring tools. It allows patients to consult healthcare providers without needing to be physically present, which is particularly useful in rural or underserved areas. Key advantages of telemedicine equaled increased access, providing healthcare to patients in remote locations, reducing the need for travel, and making it easier to get timely medical advice. Cost effectiveness, lowering the cost of healthcare by minimizing unnecessary hospital visits and reducing overhead costs. Continuity of care, offering consistent monitoring and follow-up for patients with chronic conditions through remote checkups. Telemedicine experienced exponential growth during the COVID-19 pandemic, as social distancing measures forced healthcare systems to adopt remote care solutions. It's now a critical part of healthcare delivery, particularly for mental health services, primary care consultations, and specialist referrals. However, concerns remain regarding data privacy, the digital divide, and the need for updated regulations. Offering promising solutions to some of the sector's most pressing challenges. AI technologies can analyze vast amounts of data quickly and accurately, assisting in diagnostics, treatment, planning, and administrative tasks. AI applications in healthcare include medical imaging. Our tools can enhance the accuracy of detecting abnormalities in medical images, for example, X-rays, MRIs, CT scans, aiding radiologists in diagnosing conditions like cancer and heart disease. Predictive analytics. AI algorithms can predict patient outcomes. Virtual assistants. AI-based virtual assistants, such as chatbots, provide patients with 24/7 support for symptoms, assessment, medication reminders, and scheduling appointments. Personalized medicine. AI helps customize treatment plans based on individual patient profiles, such as genetic information, improving the precision and effectiveness of treatments. Despite the advantages, there are ethical concerns related to AI in healthcare, including data privacy, potential biases in AI algorithms, and the need for stringent regulatory frameworks to ensure patient safety. Emerging technologies. Wearables, robotics, on-die, healthcare industry is witnessing the rise of several emerging technologies that are transforming how healthcare services are delivered and managed. Key technology ensild, wearables, devices such as smartwatches, fitness trackers, and biosensors are becoming integral to personal health management. These devices continuously monitor vital signs like heart rate, blood pressure, sleep patterns, and physical activity. Healthcare providers can use data from wearables to monitor chronic conditions like diabetes or hypertension, improving preventative care. Robotics. Robotics in healthcare is revolutionizing surgical procedures and patient care. Surgical robots, such as the Da Vinci surgical system, allow surgeons to perform minimally invasive surgeries with precision and reduced recovery times. Care robots are also being used to assist elderly or disabled patients in their daily activities, providing companionship and support. Artificial intelligence. AI continues to be an emerging technology across various aspects of healthcare, from diagnosing diseases to optimizing hospital operations. AI-powered chatbots, for example, can engage with patients, providing initial consultation and triaging before a human healthcare provider intervenes. These emerging technologies hold immense potential to improve healthcare delivery, patient outcomes, and system efficiency. However, challenges related to data security, ethics, and integration with existing healthcare systems need to be addressed to maximize their impact. Conclusion: digital healthcare and technology are transforming healthcare by improving the accessibility, efficiency, and quality of medical services. Health information systems, electronic health records, telemedicine, AI, and emerging technologies such as wearables and robotics are at the forefront of this transformation. However, the successful integration of these technologies into healthcare requires addressing challenges related to interoperability, privacy, regulatory compliance, and the digital divide. In the coming years, continued innovation in digital healthcare will be essential in meeting the evolving needs of patients and healthcare providers alike, paving the way for a more connected and efficient healthcare system. Chapter 9: Healthcare Policies and Regulations. Healthcare policies and regulations are critical to ensuring that healthcare systems around the world operate efficiently, equitably, and safely. These policies dictate how care is delivered, financed, and managed, impacting patients, providers, and institutions. In this chapter, we will explore global healthcare policies, delve into specific regulations in major countries like the USA, UK, and Canada, and examine the roles of regulatory agencies in maintaining quality and safety in healthcare. Global healthcare policies. Global healthcare policies are designed to promote universal health coverage, improve access to care, and reduce healthcare disparities worldwide. These policies are often shaped by international organizations such as the World Health Organization (WHO), World Bank, and United Nations (UN), which work with countries to establish frameworks for healthcare systems. Some key global healthcare goals include universal helderkivuk, a core principle, policies, Ukomstonsen international Lechatarential adopted byho, Hierprovisifrafork, reporting, and responsibilspik, including pandikmisentassen, global halthanishavate, collaborative affairs, sukastheglabafintong, tuberculosis, and malaria. Focus on combating, kalangezing galabatal addressing health equation, and improving koffequatiswaitatifu, global haltha kessel, todreska manschultar. The Affordable Care Act ACA in the USA. The Affordable Care Act ACA, signed into law in 2010 by President Barack Obama, represented a major shift in healthcare policy in the United States. The ACA aimed to expand healthcare access, improve the quality of care, and reduce healthcare costs. Key provisions of the ACA include Medicaid Pension, the ACA, expand medicability income individuals, allowing millions of uninsured Americans to gain coverage. Healthinsurancemak, Thesion Leneplatwarsanafa forfod, Topurchase insurance, often with subsidum, pre-existing conditions, Theacaprohibitisake, existing healthistindinstistindin, individual mate, this required amastian. Although this mandate was later eliminated in 2019, the cafaced siginicatifitabiti including severicum, despitethesical, it suicided in chuchin, and providingmisforv, the council propomated basid kurbian singchant. However, debates over helistature, coverageaps, and thefuturiafa. NHS policies and reforms in the UK. The National Health Service (NHS), established in 1948, is the publicly funded healthcare system of the United Kingdom. It provides comprehensive healthcare services to all residents, funded primarily through taxation. Over the decades, the NHS has undergone various reforms to improve its efficiency, sustainability, and quality of care. Key reforms and policies include NES 5-year forward view 2014. This strategic polation, thens called impripriways, it focused on instigristisstavest, reducing hospitasm, and expanding precamary. Long term plan 2019, building got the 5-year forward view. This plenum stostrapaster, mental health services, and preventive care. It also emphasizes work for seplaning, then chastisation fates, leading topolitionist. Improving work instinct, and addressing the thenzil salsifashink, agging populations, and increasing dysmorphism. Ongoing debation 12. Remain sustainabink. Canadian Health Act and provincial regulations. The Canada Health Act, CHA, enacted in 1984, sets the framework for Canada's publicly funded healthcare system, known as Medicare. The CHA establishes principles to ensure universal healthcare access for all Canadian citizens and permanent residents, regardless of their ability to pay. The 5 core principles of the Canada Health Act are: 1. Public administration, provincial and territorial health insurance programs must be administered by a public authority. 2. Comprehensiveness. All necessary healthcare services, including hospitals, physicians, and surgical dental services, must be covered. 3. Universality. All insured residents are entitled to the same level of healthcare services. 4. Portability. Residents moving from one province to another must continue to receive coverage. 5. Accessibility. Health services must be provided without financial or other barriers. Healthcare delivery in Canada is a provincial responsibility, meaning that each province and territory manages its own healthcare system in accordance with the CHA. Provincial regulations vary, but all must comply with the Act's core principles. Challenges in the Canadian healthcare system include long wait times for certain services, physician shortages, and the need to address the healthcare needs of remote and Indigenous communities. Recent discussions have focused on how to enhance access to care and integrate technology to improve healthcare delivery across provinces. Regulatory agencies in healthcare regulation are enforced by various regulatory agencies that ensure the safety, efficacy, and quality of healthcare services and products. These agencies oversee everything from pharmaceuticals to medical devices and healthcare delivery standards. Let's look at key regulatory bodies in the USA, UK, and Canada. 1. The Food and Drug Administration (FDA) in THUSA. THEFTA is responsible for protecting public health by ensuring the safety, efficacy, and security of drugs, medical devices, food, cosmetics, and biological products. Its roles include approving new medications and medical devices, monitoring the safety of products post-market, ensuring that manufacturers comply with regulatory requirements. The FDA also plays a crucial role in regulating the development and approval of vaccines and treatments, particularly evident during the COVID-19 pandemic. 2. The National Institute for Health and Care Excellence (NICE) in the UK. NICE provides national guidance and advice to improve health and social care in the UK. It evaluates the cost-effectiveness of treatments and procedures to ensure that the NHS provides high-quality care at a sustainable cost. NICE's decisions directly influence what treatments are available through the NHS and help set quality standards for healthcare providers. 3. Health Canada. Health Canada is the federal agency responsible for ensuring the health and safety of Canadians. It regulates pharmaceuticals, medical devices, food products, and consumer goods. Health Canada also oversees public health initiatives and health promotion programs, such as vaccination campaigns and substance abuse prevention. Health Canada works closely with provincial healthcare systems to align national health policies with provincial regulations, ensuring comprehensive healthcare across the country. Conclusion. Chapter 9 has provided an overview of healthcare policies and regulations at both global and national levels, with a focus on the USA, UK, and Canada. From the Affordable Care Act in the US to the NHS in the UK and the Canada Health Act. Each country's healthcare system has unique structures, policies, and regulatory bodies. These frameworks are essential for ensuring equitable access to quality healthcare and managing the complexities of healthcare delivery. Understanding these policies is crucial for healthcare professionals, policymakers, and regulators alike, as they shape the future of global health. Chapter 10. Healthcare Research and Evidence-Based Practice. Importance of research in healthcare. Healthcare research is fundamental to advancing medical knowledge, improving patient care, and shaping public health policies. The importance of healthcare research can be summarized as follows. Advancing medical knowledge. Research helps identify new diseases, treatments, and preventive strategies. Without research, healthcare would stagnate, and advancements in understanding complex conditions like cancer, diabetes, and heart disease would be impossible. Improving patient care through research, healthcare professionals can develop more effective treatments and interventions, ultimately improving patient outcomes. Clinical guidelines and protocols used in hospitals are often developed based on the latest research findings. Shaping public health policies. Research influences public health policies by providing data-driven insights into health trends, risks, and outcomes. For example, policies on vaccination, smoking cessation, and disease prevention are often informed by comprehensive healthcare research. Fostering innovation. Research creates the foundation for new medical technologies, therapies, and healthcare delivery methods. By exploring novel approaches, research leads to continuous innovation, improving the overall quality of healthcare. Clinical trials and research ethics. Clinical trials are a key part of medical research, essential for testing new treatments, drugs, and medical devices. However, conducting these trials comes with strict ethical guidelines to ensure patient safety and the integrity of research findings. Phases of clinical trials. Phase I, testing new treatments on a small group of people to assess safety and dosage. Phase II, expanding the group to further evaluate safety and effectiveness. Phase III involves large-scale testing to confirm effectiveness. Monitor side effects and compare the new treatment with standard therapies. Phase IV, conducted after the treatment is approved to gather more information on long-term effects and safety in diverse populations. Ethics in clinical trials. Informed consent. Participants must fully understand the purpose, risks, and benefits of the trial before consenting to participate. Beneficence and non-maleficence. Trials should aim to benefit participants while minimizing harm. Justice. Participants must be selected fairly without bias, ensuring that certain groups aren't unfairly included or excluded. Autonomy. Participants have the right to withdraw from the study at any time without penalty. Regulatory oversight. Organizations such as the U.S. Food and Drug Administration (FDA) and European Medicines Agency (EMA) play crucial roles in overseeing clinical trials to ensure compliance with ethical and safety standards. How to interpret healthcare research. Understanding and interpreting healthcare research is critical for healthcare professionals and policymakers to apply findings accurately. This section will focus on essential concepts to evaluate the quality and relevance of research. Study design. Randomized controlled trials (ARCs), considered the gold standard for clinical trials, where participants are randomly assigned to receive either the treatment or a placebo to measure effectiveness without bias. Cohort studies. Observational studies following a group of people over time to examine risk factors and outcomes. Case control studies. Compare patients with a specific condition to those without, looking retrospectively at risk factors. Meta-analysis combines results from multiple studies to provide a higher statistical power and a broader understanding of the topic. Key statistical concepts. P-value, a measure of the probability that the observed results occurred by chance. A p-value less than 0.05 typically indicates statistical significance. Confidence interval (CI) provides a range of values within which the true effect is likely to lie, giving insight into the precision of the estimate. Relative risk (RR) and odds ratio (OR). These are used to quantify the likelihood of an event happening in one group compared to another. Assessing bias and validity. Internal validity, the degree to which the results of a study are accurate for the participants in the study. External validity, the extent to which the findings can be generalized to other populations. Confounding variables, external factors that could skew the results or misrepresent the relationship between variables. Evidence-based practice in medicine. Evidence-based practice (EBP) integrates clinical expertise, patient values, and the best available evidence from research to make informed decisions about patient care. It is a cornerstone of modern healthcare. Principles of evidence-based practice. Best research evidence. Clinicians use up-to-date research findings to guide their decisions. Clinical expertise. While research is essential, the practitioner's expertise in applying this knowledge to specific patient contexts is critical. Patient values and preferences. The patient's preferences, values, and individual circumstances should be considered in decision-making. Steps in implementing evidence-based practice. EBP. 1. Ask. Formulate a clear clinical question based on the patient's problem using the PICO model: patient, intervention, comparison, outcome. 2. Acquire. Search for the best evidence in medical literature, databases, and clinical guidelines. 3. Appraise. Critically assess the quality and relevance of the research. 4. Apply. Use the findings to make decisions in patient care, integrating clinical expertise and patient preferences. 5. Assess. Evaluate the outcomes and make adjustments H1 if necessary. Challenges in evidence-based practice. Lack of access to high-quality research. Time constraints in busy healthcare settings. Difficulty in applying research findings to individual patient cases. Innovations in medical research. Innovations in medical research are driving the future of healthcare, providing new ways to diagnose, treat, and prevent diseases. This section focuses on groundbreaking developments in the field. Genomics and personalized medicine. Advances in genomics have led to personalized medicine, where treatments can be tailored to an individual's genetic makeup. This has improved outcomes in areas like oncology, where targeted therapies are revolutionizing cancer treatment. Artificial intelligence (AI) and research. AI and machine learning are being used to analyze large datasets, uncover patterns, and predict outcomes in clinical research. AI is also aiding in drug discovery, reducing the time and cost associated with developing new treatments. Telemedicine and remote trials. Telemedicine allows for remote participation in clinical trials, increasing accessibility for patients who may be unable to travel to research centers. This innovation helps diversify clinical trial populations and improve research outcomes. CRISPR and gene editing. CRISPR technology enables precise editing of genes, offering new possibilities for curing genetic diseases. Ongoing research into its ethical use is crucial, especially concerning germline editing and potential long-term impacts. Nanotechnology in medicine. Nanomedicine involves using nanoparticles for drug delivery, diagnostics, and therapeutic applications. Research is advancing in areas like cancer treatment, where nanoparticles are used to target tumor cells more effectively with fewer side effects. Conclusion. Chapter 10 highlights the importance of healthcare research and evidence-based practice in advancing medicine, improving patient outcomes, and fostering innovation. Understanding the ethical foundations of clinical trials, how to interpret research data, and the application of evidence-based practice is essential for healthcare professionals. Finally, innovations in medical research hold the promise of transforming how diseases are treated and prevented, paving the way for more personalized and effective healthcare solutions. Chapter 11: Public Health and Epidemiology. Introduction to Public Health. Public health is the science of protecting and improving the health of populations through education, promotion of healthy lifestyles, and research on disease and injury prevention. It focuses on the prevention of illnesses and the prolongation of life by promoting physical and mental health, sanitation, personal hygiene, control of infectious diseases, and organization of health services. Public health differs from individual medical care in that it targets populations rather than focusing on the health of individual patients. Key public health activities include monitoring the health status of a community, diagnosing and investigating health problems and hazards, Developing policies that support individual and community health efforts. Ensuring a competent public health workforce. Promoting accessibility to health services. Public health is critical for identifying health risks at the population level and implementing policies and programs to address these risks. This involves a wide range of professionals, including epidemiologists, health educators, policymakers, and community health workers. Epidemiology, study of diseases. Epidemiology is a cornerstone of public health, defined as the study of the distribution and determinants of health-related events in populations. Its purpose is to understand the patterns, causes, and effects of health and disease conditions, which informs the development of public health interventions. Epidemiology involves descriptive epidemiology, focuses on understanding the who, what, where, and when of health events. It identifies patterns based on demographic factors, such as age, gender, and geography. Analytical epidemiology examines the why and how of health events, identifying factors that increase the risk of disease and analyzing how interventions impact health outcomes. Experimental epidemiology conducts experiments to test interventions or new treatments, which can involve randomized controlled trials or observational studies. Epidemiologists use various metrics, such as incidence new cases, prevalence total cases, morbidity illness, and mortality deaths, to assess the health of a population. Key examples of epidemiological work include the study of the spread of infectious diseases such as COVID-19 or influenza, and the identification of risk factors for chronic diseases like heart disease or cancer. Outbreak management and response. Effective outbreak management is a critical function of public health. When an infectious disease spreads rapidly within a community or population, timely intervention is crucial to prevent widespread illness and death. Outbreak management includes several key steps: detection, confirmation, investigation, control, and prevention. Example 1. COVID-19 response in the UK. In the UK, public health officials responded to the COVID-19 outbreak by implementing strict lockdowns, mass testing, and later, vaccination campaigns. The National Health Service (NHS) played a key role in managing hospital resources, while the UK government launched public health campaigns to promote hand hygiene, mask wearing, and social distancing. Example 2. COVID-19 response in the USA. The United States response involved both federal and state agencies, with the Centers for Disease Control and Prevention (CDC) providing guidance on social distancing, quarantine measures, and vaccination. Despite early challenges, the USA successfully distributed vaccines to millions of citizens through mass vaccination sites and pharmacies. Example 3. COVID-19 response in Canada. Canada took a more cautious approach, implementing strict border controls and lockdowns to curb the spread of the virus. The country also launched large-scale vaccination programs, with the government providing financial support for those affected by the economic downturn caused by the pandemic. Effective outbreak response often requires collaboration between national governments, international organizations, healthcare providers, and the public. In the case of COVID-19, widespread testing, contract tracing, public health campaigns, and vaccine distribution were critical to managing the pandemic. Health promotion and disease prevention. Health promotion focuses on enabling people to increase control over and improve their health. It moves beyond individual behavior and focuses on a wide range of social and environmental interventions. Disease prevention, on the other hand, aims to reduce the occurrence of diseases by implementing measures that limit exposure to risk factors and increase resilience to health challenges. Health promotion strategies can include education and dasmains, encouraging healthevishie, such as quitingsma, and increasing physical, and improving diet. Vaccination programs. Preventigen infectiosité, such as measles, polio, and influenza, through massiminicadas. Screening programs, early detection of diabetes or hypertension guarchorguarjorthero upsansting. Example sofsafant, promoting Gregulex. Smoking cessatorsing, and public healthiation, such as poverty, education, and housing. Thigo alo feel fancy de tondi deity. Ultimately cheng life expectancy. Global Health Initiatives WHO, CDC. UK Public Health. Global health initiatives aim to address health challenges that transcend national boundaries and require international collaboration. Many organizations work to improve global health outcomes, with the following being key players. World Health Organization WHO, WHO is the leading authority on global health, coordinating international health efforts and providing guidance to countries on managing health crises. It sets global health standards, monitors disease outbreaks, and provides leadership in international health policy. WHO played a central role in the COVID-19 pandemic by coordinating global efforts to manage the virus, providing technical guidance, and facilitating the distribution of vaccines through the COVAX initiative. Centers for Disease Control and Prevention CDC, CDC, based in the United States, is one of the foremost public health institutions in the world. It works to protect public health by controlling and preventing disease outbreaks, particularly infectious diseases. The CDC also provides training and resources to other countries in areas like epidemiology, emergency preparedness, and public health interventions. UK Public Health, England, now succeeded by the UK Health Security Agency, focuses on improving the nation's health and tackling inequalities. The organization provides policy guidance, coordinates public health campaigns, and responds to health emergencies. During the COVID-19 pandemic, the UK's public health authorities played a pivotal role in coordinating testing, vaccination, and public health messaging to manage the outbreak. The global health organizations work together to address international health threats, from pandemics to chronic disease, and aim to reduce health disparities between and within countries. Conclusion: public health and epidemiology play crucial roles in improving population health and preventing disease. From understanding the spread of diseases through epidemiology to managing outbreaks like COVID-19, public health efforts require collaboration between local, national, and international bodies. Health promotion and disease prevention initiatives are equally important for reducing the burden of illness and promoting healthier lifestyles. Organizations like WHO, CDC, and UK Public Health are essential for driving global health efforts and ensuring better health outcomes for all populations. Chapter 12: Specializations in Healthcare. In this chapter, we will explore the different specializations within healthcare, focusing on the roles that contribute to the medical field. The healthcare industry is diverse and multifaceted, with professionals working in various specialized areas to meet patient needs. Each specialization requires a unique set of skills, knowledge, and training. We will cover key medical specializations, allied health professionals, mental health, geriatric care, and pediatric healthcare. Overview of medical specializations, for example, nursing, dentistry, pharmacy. Medical specializations are essential to delivering high-quality care and ensuring patients receive treatment tailored to their specific needs. Each specialization involves a focused area of study and practice, with healthcare professionals gaining deep knowledge and experience in their respective fields. Some of the most prominent specializations include nursing. Nurses play a critical role in patient care, working closely with doctors and other healthcare professionals. There are various subspecializations within nursing, such as pediatric nursing, critical care nursing, and oncology nursing, each focusing on different patient demographics and healthcare needs. Dentistry. Dentists focus on oral health, diagnosing and treating issues related to teeth, gums, and other areas of the mouth. Specializations within dentistry include orthodontics, periodontics, and oral surgery, dealing with specific aspects of dental care. Pharmacy. Pharmacists are responsible for dispensing medications, counseling patients on proper use, and ensuring medication safety. Specializations in pharmacy can include clinical pharmacy, hospital pharmacy, and pharmaceutical research, each playing a unique role in patient care and medication management. General medicine. General practitioners, GPs, or family doctors provide primary health care, diagnosing and treating a wide range of conditions. They focus on preventive care, managing chronic diseases, and coordinating care with specialists when needed. Cardiology. Cardiologists specialize in diagnosing and treating conditions of the heart and blood vessels, such as heart disease, hypertension, and arrhythmias. They perform procedures like echocardiograms, stress tests, and catheterizations. Oncology. Oncologists specialize in the diagnosis, treatment, and management of cancer. There are subspecializations, including medical oncologists who treat cancer with chemotherapy, surgical oncologists who perform surgeries to remove tumors, and radiation oncologists who treat cancer with radiation therapy. Neurology. Neurologists focus on disorders of the brain, spinal cord, and nervous system. They treat conditions like epilepsy, stroke, multiple sclerosis, and Parkinson's disease. Orthopedics. Orthopedic surgeons specialize in the treatment of the musculoskeletal system, including bones, joints, muscles, ligaments, and tendons. They often treat fractures, perform joint replacements, and address spinal problems. Dermatology. Dermatologists diagnose and treat conditions related to the skin, hair, and nails. Common conditions include acne, eczema, psoriasis, and skin cancer. Ophthalmology. Ophthalmologists specialize in eye health, including the diagnosis and treatment of eye diseases such as glaucoma, cataracts, and macular degeneration. They also perform eye surgeries like LASIK and cataract removal. Gastroenterology. Gastroenterologists specialize in the digestive system, treating conditions like ulcers, Ibs irritable bowel syndrome, Crohn's disease, and liver disorders. They perform procedures like endoscopies and colonoscopies. Pulmonology. Pulmonologists focus on respiratory system diseases, including asthma, chronic obstructive pulmonary disease, and lung infections. They treat disorders of the lungs and airways. Nephrology. Nephrologists specialize in kidney health, diagnosing and treating kidney diseases, including chronic kidney disease and kidney failure. They also manage dialysis treatment for patients with renal failure. Endocrinology. Endocrinologists treat hormone-related disorders, including diabetes, thyroid disorders, and adrenal gland issues. They focus on managing conditions that affect the endocrine system. Obstetrics and gynecology. OB/GYN. Obstetricians and gynecologists specialize in women's health, particularly in childbirth and reproductive health. They provide prenatal care, deliver babies, and treat conditions of the female reproductive system. Rheumatology. Rheumatologists diagnose and treat autoimmune and inflammatory diseases that affect the joints and muscles, such as rheumatoid arthritis and lupus. Urology. Urologists specialize in the urinary system and male reproductive organs. They treat conditions like kidney stones, urinary tract infections, prostate issues, and bladder control problems. Anesthesiology. Anesthesiologists are responsible for administering anesthesia during surgeries and other medical procedures. They monitor patients' vital signs and ensure they remain pain-free during operations. Palliative care and hospice. Specialists in palliative care provide comfort-focused care to patients with serious, life-limiting illnesses. They focus on pain management, symptom relief, and improving quality of life for patients in hospice care. Emergency medicine specialists work in emergency departments, providing immediate care for acute injuries and illnesses, including trauma, heart attacks, and strokes. Hematologists specialize in blood disorders, such as anemia, clotting disorders, leukemia, and lymphoma. They manage both malignant and non-malignant blood diseases. These medical specializations require extensive training and advanced education, each with its own focused area of patient care. By specializing, healthcare professionals are able to provide deeper expertise in diagnosing and treating complex medical conditions. Allied health professionals, for example, therapists, radiologists. Allied health professionals are a vital part of the healthcare team, supporting diagnosis, treatment, and rehabilitation efforts across various medical fields. These professionals often work alongside doctors and nurses, providing essential services that contribute to comprehensive patient care. Key allied health specializations include therapists. This category includes physical therapists, occupational therapists, and speech therapists. These professionals help patients recover from injuries, surgeries, or chronic conditions by improving mobility, functionality, and communication skills. Radiologists are experts in medical imaging, using technologies such as X-rays, MRIs, and CT scans to diagnose diseases and injuries. They play a crucial role in detecting abnormalities, guiding treatment decisions, and monitoring patient progress. Medical technologists and laboratory technicians. These professionals are responsible for analyzing bodily fluids and tissues, conducting tests that help diagnose illnesses. Their work is often behind the scenes, but is critical for accurate diagnoses and treatment plans. Allied health professionals are indispensable in delivering specialized care that meets patient needs across various medical contexts. Mental health and psychology. Mental health is an essential component of overall well-being, and the demand for mental health services has increased significantly in recent years. Mental health professionals specialize in diagnosing and treating psychological disorders, providing therapy, counseling, and support to individuals struggling with mental health challenges. The main specializations in this field include psychiatrists, medical doctors who diagnose and treat mental illnesses through a combination of therapy and medication management. Psychiatrists have the authority to prescribe medications to help manage mental health conditions. Clinical psychologists. These professionals focus on assessing and treating emotional, mental, and behavioral disorders through therapeutic techniques, such as cognitive behavioral therapy (CBT) and psychotherapy. They often work in hospitals, clinics, or private practice. Counselors and therapists. Counselors provide emotional support and guidance to individuals facing personal challenges, trauma, or stress. They often specialize in areas like marriage and family therapy, substance abuse counseling, or grief counseling. Social workers. Social workers in mental health support individuals and families dealing with mental health issues, often connecting them with resources and services to improve their quality of life. Mental health professionals work across various settings, including hospitals, private practices, schools, and community health centers, to address the growing need for psychological support. Geriatrics and aging populations. As global population ages, healthcare services for the elderly are becoming increasingly important. Geriatrics is the branch of medicine that focuses on the healthcare needs of older adults, addressing issues such as chronic diseases, mobility problems, and cognitive decline. Healthcare professionals specializing in geriatrics include geriatricians. These doctors specialize in treating older adults. focusing on the management of multiple chronic conditions, medication safety, and age-related health issues like dementia, osteoporosis, and arthritis. Geriatric nurses. Geriatric nurses provide specialized care for elderly patients, helping manage their day-to-day health needs, including medication administration, pain management, and mobility assistance. Home health aides. Many aging individuals require assistance with daily activities such as bathing, dressing, and meal preparation. Home health aides provide the support in a patient's home, ensuring that they can live independently for as long as possible. Physical and occupational therapists. These professionals play a key role in helping older adults maintain mobility and independence. Physical therapists assist with mobility and rehabilitation, while occupational therapists focus on helping elderly individuals adapt to their physical limitations and continue to perform daily tasks. The demand for healthcare professionals specializing in geriatrics is expected to grow as populations continue to age, creating a need for more resources and support for older individuals. Pediatric healthcare. Pediatric healthcare focuses on the medical needs of infants, children, and adolescents, requiring specialized knowledge of child development, growth, and common childhood diseases. Healthcare professionals who specialize in pediatrics include pediatricians. Pediatricians are doctors who manage the physical, behavioral, and mental health of children. They diagnose and treat illnesses, from minor infections to serious diseases, and provide preventive care to promote healthy growth and development. Pediatric nurses. These nurses are trained to work with children and families, providing care in settings like hospitals, clinics, and schools. They assist with vaccinations, monitor developmental milestones, and provide education to parents about their child's health. Neonatologists. Neonatologists specialize in the care of newborns, particularly those born prematurely or with serious health conditions. They work in neonatal intensive care units (NICUs) to provide life-saving treatment to infants in critical condition. Pediatric surgeons. These surgeons specialize in performing surgeries on children, addressing congenital anomalies, trauma, and other medical conditions that require surgical intervention. Pediatric healthcare professionals play a critical role in ensuring that children grow up healthy, with access to preventive care, early diagnosis, and effective treatment. Conclusion: healthcare is a diverse field with numerous specializations, each critical to providing comprehensive patient care. From medical professionals like nurses and pharmacists to allied health workers and mental health experts, each plays an essential role in maintaining and improving patient health across various demographics. As healthcare needs evolve, so too does the demand for specialized professionals, equipped to address the unique challenges of different patient populations, from children to the elderly. Understanding these specializations is vital for anyone entering the healthcare field or working alongside healthcare professionals. Chapter 13: Preparing for a Career in Healthcare. UK, USA, Canada. Healthcare careers in the UK, USA, and Canada offer rewarding opportunities for professionals passionate about improving lives. However, navigating the education, certification, and job application processes in these countries can be challenging. Chapter 13 will guide you through each step to help you prepare for a successful healthcare career in these regions. Education pathways for healthcare careers. UK, USA, and Canada. Each country has distinct educational pathways that prospective healthcare professionals must follow to enter the field. Here's an overview of the education requirements in the UK, USA, and Canada. United Kingdom. UK. In the UK, healthcare professionals usually begin their journey with the relevant undergraduate degree. For example, doctors pursue a Bachelor of Medicine, Bachelor of Surgery (MSc), while nurses opt for a Bachelor of Nursing (BN). After completing undergraduate training, medical professionals must undergo foundation training, which lasts 2 years and involves practical work in hospitals. United States, USA, aspiring healthcare professionals must complete an undergraduate degree in a relevant subject, such as biology or chemistry. Afterward, those pursuing a medical career enroll in medical school, which typically takes 4 years. Upon graduation, they undertake residency programs lasting between 3 to 7 years, depending on the specialty. For nursing and allied health roles, students often earn associate's or bachelor's degrees in nursing or other healthcare fields, followed by professional licensing exams. Canada. In Canada, healthcare professionals follow a pathway similar to the USA. Doctors complete an undergraduate degree, followed by 4 years of medical school. Graduates then enter residency programs, ranging from 2 to 5 years based on their specialty. For nurses and other allied health professionals, a bachelor's degree in nursing or a relevant field is typically required, followed by national certification. Certifications and licenses. NHS, USM, Canadian certification. Certifications and licenses are mandatory for practicing healthcare professionals in the UK, USA, and Canada. Each country has specific exams and certifications tailored to its healthcare system. United Kingdom. NHS. In the UK, doctors need to register with the General Medical Council (GMC) after completing their foundation training. Nurses and allied health professionals must obtain certification from the Nursing and Midwifery Council (NMC). United States. USM. In the USA, medical professionals are required to pass the United States Medical Licensing Examination (USM), a 3-step exam that assesses their readiness to practice medicine. Nurses must pass the NCLEX-R National Council Licensure Examination to become registered nurses. Other allied healthcare professionals must obtain certifications from bodies like the American Medical Association (AMA) or American Nurses Credentialing Center (Inc.). Canadian certification. In Canada, doctors must pass the Medical Council of Canada Qualifying Examination (MCA) and obtain certification from the Royal College of Physicians and Surgeons of Canada. Nurses must pass the NCLEX-R, the same as in the USA, or a provincial equivalent. Many other healthcare professionals need certification from relevant bodies, such as the Canadian Nurses Association (CNA) or the Canadian Medical Association (CMA). How to write a healthcare resume for UK, USA, and Canada. A well-crafted healthcare resume can significantly enhance your chances of landing a job. Although the general structure remains consistent across the UK, USA, and Canada, there are subtle differences in formatting and content for each country. UK. Personnel details include Arnhem, contact information, and professionalist. Personal statement, a short section alloquin experience, and caregivers. Experience, listi or relevantry, highlighting click into can. Education, detail or documentation. Skills, emphasis a clinicism. References, intuk. Its commentoints feelance students view available upon request. USA. Contact information, include your name, address, phone number, and email. Objective, a brief statement about your career goals and how they align with the role you're applying for. Education, include all degrees and certifications. For medical professionals, include residency and fellowship details. Experience, highlight clinical rotations, internships, and previous healthcare roles, along with any leadership positions. Skills, mention relevant clinical skills, such as diagnostic expertise and patient care techniques. Certifications, list any certifications like USM or NCLEX-R and the year you obtained them. References, not typically included on resumes, but should be prepared upon request. Canada, contact information, similar to the USA, include your full name, address, and contact details. Summary, a career summary or objective that provides an overview of your professional qualifications and goals. Education, detail your academic qualifications, including university degrees and certifications. Professional experience, include detailed descriptions of your work history, particularly clinical and practical experience. Certifications, list any relevant certifications such as McKay, NCLEX ARN, or CNA. Skills, highlight both technical and soft skills that are relevant to the job. References, not required on resumes, but should be ready when asked. Seeing healthcare job interviews. Successfully navigating healthcare job interviews requires a combination of confidence, preparation, and familiarity with industry-specific questions. Below are additional common interview questions you may encounter when applying for healthcare positions in the UK, USA, and Canada. Common interview questions. Tell me about yourself. Focus on your education, experience, and passion for healthcare. How do you handle stressful situations? Give examples from clinical settings where you successfully managed pressure. What makes you a good fit for this role? Highlight specific skills and experiences relevant to the position. Why did you choose a career in healthcare? Highlight your motivation for entering the healthcare field, emphasizing your dedication to helping others and your interest in medical science. Describe a time when you had to handle a difficult patient or family member. How did you resolve the situation? Explain a specific situation, focusing on your communication skills and how you maintain professionalism and empathy. What makes you a good fit for this role? Discuss your relevant qualifications, experience, and specific skills that match the job description. Can you give an example of how you work within a multidisciplinary team? Explain how you've collaborated with other healthcare professionals, such as doctors, nurses, and support staff, to deliver comprehensive care. How do you prioritize your tasks when working under time constraints? Highlight your time management and organizational skills, giving an example of a situation where you effectively prioritized patient care. Tell me about a time when you had to deal with a medical error or a challenging clinical decision. Demonstrate your problem-solving abilities and how you ensured the best outcome for the patient, including how you handled the situation and learned from it. How do you ensure patient confidentiality and adhere to data protection regulations? Discuss your understanding of patient confidentiality laws, for example, HIPAA in the USA, GDPR in the UK and EU, and how you protect patient information in your daily work. How do you stay updated with the latest medical advancements and best practices in healthcare? Talk about how you engage in continuous learning, such as attending conferences, participating in workshops, and completing certifications. What strategies do you use to handle emotional or difficult situations with patients and their families? Share how you remain empathetic, provide emotional support, and maintain professionalism in emotionally charged situations. Describe a time when you disagreed with a colleague about a patient's treatment plan. How did you handle it? Highlight your communication and conflict resolution skills, focusing on collaboration and putting patient care first. How do you manage a situation where you feel overwhelmed or overworked? Discuss your coping mechanisms and strategies for maintaining a work-life balance, such as seeking help from colleagues or using stress management techniques. What do you believe are the most important qualities for a healthcare professional? Focus on traits like empathy, attention to detail, communication skills, adaptability, and a commitment to patient-centered care. How do you handle ethical dilemmas in healthcare, such as end-of-life decisions or patient autonomy? Provide an example where you adhered to ethical guidelines, emphasizing respect for patient rights and consulting with the healthcare team when necessary. Can you describe a situation where you went above and beyond for a patient? Highlight your dedication to patient care, demonstrating how you took extra steps to ensure a positive outcome. How do you ensure that you maintain accuracy and attention to detail in a fast-paced healthcare environment? Discuss strategies you use to stay organized and prevent errors, such as checklists, double-checking work, and collaborating with colleagues. How do you manage working with culturally diverse patients and respect their individual needs? Talk about how you adapt your care to meet the cultural and religious needs of patients, and how you ensure inclusivity and respect. What do you think are the biggest challenges in healthcare today, and how would you address them? Offer insights on issues such as staffing shortages, technological advancements, or healthcare access, and suggest practical solutions based on your experience. UK interviews. In the UK, NHS interviews often include competency-based questions to assess your clinical and communication skills. You may be asked to discuss case studies or scenarios involving patient care. Use interviews. In the USA, interviews for healthcare positions, especially in hospitals, often include situational and behavioral questions. For example, describe a time you faced a challenge with a patient and how you handled it. Canada interviews. In Canada, healthcare interviews typically focus on your ability to work in teams, deal with difficult patients, and manage multiple tasks. Interviewers may ask questions about specific procedures or your approach to patient care. Preparation tips. Research the healthcare system in the country where you're applying. Review common medical scenarios and how to respond. Practice answering both technical and behavioral questions. Continuing education and professional development. Healthcare professionals in the UK, USA, and Canada must engage in continuous learning to maintain their licenses and keep up with the latest advancements in medicine and healthcare. UKNs. Healthcare professionals in the UK, particularly those working within the NHS, are required to undertake continuous professional development (CPD) to maintain their professional registration. CPD activities include attending workshops, conferences, and completing online courses. USA. In the USA, healthcare professionals must meet specific continuing medical education (CME) requirements to maintain their licenses. For example, doctors need to complete a set number of CME credits each year, which can be earned by attending medical conferences or completing online modules. Canada. In Canada, professionals are required to complete continuing education activities to remain in good standing with regulatory bodies like the Royal College of Physicians and Surgeons of Canada or the Canadian Nurses Association. This may involve attending accredited courses or earning professional credits through workshops and seminars. Conclusion. A successful healthcare career in the UK, USA, or Canada acquires a clear understanding of the educational pathways, certification requirements, and job application processes specific to each country. Whether you are just starting or looking to advance your career, continuous professional development, and staying updated on healthcare trends are essential to long-term success. Preparing effectively for job interviews and tailoring your resume to meet the requirements of the region you wish to work in will ensure a strong start in your healthcare career. Chapter 14. Healthcare, Jobs, and Immigration UK, USA, and Canada. This chapter explores the immigration pathways and visa requirements for healthcare professionals seeking employment in the UK, USA, and Canada. It also covers how to get healthcare, jobs, recognition of foreign qualifications, and tips on navigating the healthcare job market in these countries. Visa and work permit requirements for healthcare jobs in the UK. The UK is a popular destination for healthcare professionals, particularly nurses, doctors, and allied health workers. The country has streamlined its immigration processes to meet the high demand for skilled workers in healthcare. Below are the primary visa and work permit options available to healthcare professionals. Health and Care Worker Visa. This is a specialized visa designed for healthcare workers who have been offered a job in the UK. Eligible professions include doctors, nurses, social care workers, and other allied healthcare professionals. Applicants must have a certificate of sponsorship costs from a licensed UK employer, meet minimum salary requirements, and demonstrate proficiency in English. Tier 2 General Visa. Tier 2 General Visas anathoropink. Italo sio tofawikwiri. It's importantes tekrisik baz healtha carapemi. Aki benefitishwaitiamithrithrithra. Visa processingst. Application fees vary. Buthi althkaraponis. Applying gunderadel. Immigration Helcherachurch IHS is swaverd foraltwekwaradwatwartwa. Alloingthamications NHS for free. How to get a healthcare job in the USA H-1B visa EB-3 green card. Securing a healthcare job in the USA is a desirable goal for many professionals. Due to the diverse job opportunities and competitive salaries, several visa options allow healthcare workers to enter the USA and practice their profession. H-1B visa. The 1 visa is available for healthcare pepperswain. Degree equivalent and a jobofferen specialty occupant, eligible professional, physical therapists, and so mekaterisfunsforation. The employer mustiation, how will theniply for the 1 visa. Thevisa zinatalivi. EB-3 visa employment based immigration dwifurikworkwording, Thebe 3 visalotialis freeze. Including nurses, to gain permanent residency green card status. Applicants must full-time ejaboffer oma. S. Employmentient. The permanent labitruk perm process is mandatory requiring thempility. S. Worker saravavels feet. Green card forfizin. Physician Scanapri Nidable Program. Wickelos Doctors Towns. After completifies. Doctors Myaplifries. Immigration pathways for healthcare professionals in Canada express entry, PR, work permit, etc. Canada offers several immigration pathways for healthcare professionals, including temporary work permits and permanent residency PR options. The country actively seeks healthcare workers to address shortages in hospitals and clinics. Express entry sapawent based immigration C. Federal Skilled Work FSEP. Canadian Experience CEC. And Federal Skilleder Spatarum Fest Piest. Healthcare Profosen, Sukas Dr. Sandus, Canaplinder Thefts. And Successful Lucidavastin Residency. K-factor Sinobiation CRS. Score include alacufying eilt sorsalpip, work experience, and education. Provincial namiagram n, any canian provisions. Under the provincicum n. Sucas Ontario Scation. Priority estrabism, panpaplicant smove. Nominata candidatic. Work permits fortiswem. Temporary forigwar squake wape wang LMIA based work permitmits. IFA Canadian Kelataris Ephisisa. Temporary work pult. With the possibility. Recognition of foreign qualifications in the UK, USA, and Canada. A crucial aspect of working in healthcare abroad is ensuring that your qualifications are recognized in your destination country. Each country has its own process for verifying and accrediting foreign qualifications to meet national standards. UK, the General Medical Council GMC regulates doctors, while the Nursing and Midwifery Council NMC oversees nurses. Healthcare professionals must have their qualifications assessed and pass relevant exams. For example, PLAB for doctors, CBT, and OSCE for nurses to obtain a license to practice. USA, for physicians, the Educational Commission for Foreign Medical Graduates ECFEM is responsible for verifying medical degrees. Nurses must pass the NCLEX ARN exam, and many states require KFEN certification to assess foreign education and experience. Other healthcare professionals, such as pharmacists and physical therapists, must also pass U.S. certification exams. Canada, Health Canada, and Provincialisor. Nurses Muskathranction National Nursing System. Wildikter Sunsendes, MCC and Manietakamafult, or residency. How to apply for healthcare jobs in each country. Applying for healthcare jobs abroad requires preparation and understanding of the specific job market, as well as visa and qualification requirements. UK application process. Search for job vacancies on NHS job boards or private healthcare providers. Secure a certificate of sponsorship from a UK employer, which is essential for visa applications. Ensure your qualifications are recognized by relevant UK healthcare bodies, for example NMC, GMC. USA application process. Use job portals such as Indeed and LinkedIn, or healthcare-specific sites like caregivers. Prepare for sponsorship by a U.S. healthcare employer who will petition for your work visa H-1B or EB-3. Ensure you meet the educational and licensing requirements, including any exams such as the USM for doctors or NCLEX-ARN for nurses. Canada application process. Find healthcare job openings through provincial health boards or private employers. If you're applying for permanent residency, ensure you meet the Express Entry or N criteria. For temporary work permits, have your employer obtain an LMIA and submit the work permit application. Verify your credentials through the relevant Canadian healthcare regulatory bodies before applying for jobs. Conclusion. This chapter covers the essential immigration pathways, visa requirements, and procedures for healthcare professionals seeking jobs in the UK, USA, and Canada. By understanding the immigration systems, visa processes, and recognition of foreign qualifications in each country, healthcare workers can successfully pursue international career opportunities. Each destination has specific visa programs, qualification recognition processes, and job application requirements that must be met to work legally and effectively in the healthcare sector. Chapter 15. Future of Healthcare. The future of healthcare is being shaped by rapid technological advancements, global challenges, environmental factors, and evolving medical research. This chapter explores the major trends and potential changes that will define healthcare in the coming years. Trends in healthcare. The integration of advanced technologies is revolutionizing healthcare delivery and management. Key trends include artificial intelligence (AI) and machine learning (ML). AI is transforming diagnostics, predictive analytics, and personalized treatment plans, helping doctors make more informed decisions. Machine learning algorithms are also improving patient outcomes by analyzing massive datasets to predict disease patterns. Telemedicine and remote care. The COVID-19 pandemic accelerated the adoption of telehealth services. Virtual consultations, remote monitoring tools, and wearable devices now allow for more convenient, accessible, and continuous care, particularly for patients in remote areas. Robotics and automation. Robots are increasingly used in surgeries, rehabilitation, and care for the elderly. Automation is also streamlining administrative tasks, such as scheduling, billing, and record management. 3D printing. This technology is enhancing the production of custom prosthetics, implants, and even human tissue, making treatments more personalized and effective. Genomics and precision medicine. Advances in genetic research are enabling more precise, targeted therapies, where treatments are tailored to an individual's genetic makeup, leading to more effective care with fewer side effects. Global health curricles. Healthcare systems around the world face significant challenges that require global collaboration. Aging populations. Many countries are dealing with an increasing elderly population, which puts pressure on healthcare systems to provide long-term care, manage chronic diseases, and ensure adequate resources. Healthcare access and inequality. Despite advances in medicine, many regions, especially low-income countries, struggle with inadequate healthcare infrastructure and access to essential services, creating stark health inequalities. Infectious diseases, global pandemics, such as COVID-19, have highlighted the vulnerability of healthcare systems to infectious diseases. There is an urgent need for robust disease surveillance, vaccine distribution, and international cooperation. Non-communicable diseases (NCDs), the rise of chronic diseases such as diabetes, cancer, and cardiovascular diseases has created a long-term burden on healthcare systems, especially in countries experiencing rapid urbanization and lifestyle changes. The impact of climate change on health. Climate change poses a growing threat to global health, as it directly and indirectly affects the well-being of populations. Environmental health risks, increased air pollution, rising temperatures, and extreme weather events, such as floods and hurricanes, are leading to a rise in respiratory diseases, heat-related illnesses, and injuries. Food and water security. Climate change affects agriculture and water supply, leading to malnutrition and waterborne diseases in vulnerable populations. Disease spread. Warmer temperatures and changing ecosystems are expanding the geographic range of vector-borne diseases such as malaria and dengue fever. Mental health impacts. Climate-related disasters and displacement increase the risk of anxiety, depression, and post-traumatic stress disorder (PTSD), particularly in affected communities. Future of medical research and treatment. Medical research is undergoing transformative changes, with new discoveries and technologies paving the way for breakthroughs in treatment. Regenerative medicine, stem cell research, and tissue engineering are advancing the field of regenerative medicine, offering hope for repairing damaged tissues and organs, potentially curing previously untreatable conditions. Gene editing CRISPR. CRISPR technology is enabling precise modifications to DNA, which could lead to cures for genetic disorders and new approaches to cancer treatment. Immunotherapy. Immunotherapy is a promising area of cancer treatment that uses the body's immune system to fight cancer cells. It has already shown success in treating certain cancers and is likely to expand. Nanomedicine. The use of nanoparticles for drug delivery is making treatments more efficient. By targeting specific cells or tissues, minimizing side effects, and improving patient outcomes. Healthcare for the next generation. What to expect? The healthcare landscape for future generations will look vastly different as new challenges and innovations emerge. Preventive care. A shift towards preventive care will be crucial, with a focus on early detection, lifestyle changes, and wellness programs to reduce the incidence of chronic diseases. Personalized medicine. The era of one-size-fits-all treatment is ending. Personalized medicine, driven by genetic insights and health data, will enable more effective and individualized healthcare plans. Patient empowerment. The next generation of healthcare will involve more patient-centered approaches, with individuals playing a greater role in managing their own health. Through wearable technology, mobile health apps, and access to personal health data. Health equity. Addressing global health disparities will be a priority, with initiatives to improve access to care, particularly in underserved regions, becoming central to global health agendas. Sustainability in healthcare. As environmental concerns grow, healthcare systems will need to adopt more sustainable practices, from reducing waste in medical facilities to embracing energy-efficient technologies and policies. Conclusion. The future of healthcare is a dynamic and evolving field, shaped by advancements in technology, environmental factors, and global challenges. Embracing innovation and addressing these pressing issues will be essential to building healthcare systems that are equitable, sustainable, and capable of meeting the needs of future generations. Overall conclusion. Throughout this course, we have explored the dynamic and multifaceted nature of healthcare. focusing on its present challenges and the transformative innovations shaping its future. 1. Summary of key takeaways from the course. We covered essential topics, ranging from the fundamental principles of healthcare delivery and ethics to the impact of technology and global health challenges. Key takeaways include the critical role of healthcare professionals in improving patient outcomes, the increasing importance of personalized care, and the vital need to address global health inequities. We also examined how advancements in medical research, digital health technologies, and sustainable practices are transforming the healthcare landscape. 2. Encouragement for ongoing learning and development in healthcare. Healthcare is a rapidly evolving field, and staying updated on new developments is crucial. Whether through formal education, attending conferences, or staying current with the latest research, continuous learning ensures that professionals remain effective and adaptable in their roles. This course is just the beginning of your journey in healthcare, and it is important to foster a mindset of lifelong learning. 3. Resources for further study and certification. To further deepen your expertise, there are numerous resources available for continued editing. Online platforms, websites like Coursera, Analyst, Oplex Careers, and Udemy offer specialized healthcare courses. Certifications. Pursuing certifications in areas like healthcare administration, medical technology, or public health can enhance your career prospects. Professional organizations. Join organizations such as the World Health Organization, WHO, the American Medical Association (AMA), or the International Council of Nurses (ICNN), for access to the latest research, best practices, and networking opportunities.